to our health correspondent, Nicola Hill. Nicola, what more do you know about this study?
Well, it was a study done by researchers at Imperial College, and they've shown it's a small study, and I think we have to say that one straight away. But what happened was they were looking at the numbers of children in a particular part of London who were diagnosed with type 1 diabetes, and they realised the numbers had doubled from the year before, which made them suspicious. So then they thought, let's investigate and see whether the coronavirus has had any impact. And they tested the children. They tested as many as they could. Some of these children had been diagnosed earlier on, the end of March, when widespread testing wasn't available. But out of those that they did test, they found that 5 of them had either been in contact with the coronavirus or they actually had it themselves. And some of the children that were diagnosed, about 70% of them actually had a more severe form of type 1 diabetes called DKA, diabetic ketoacidosis, which can be fatal, can be life-threatening, and some of those children were seriously unwell. So the researchers involved said that this makes them think that there is a link between Covid-19 and diabetes, and what they think is that the spike protein on the virus, the one that we've seen so many pictures of, is actually destroying the insulin-making cells that are in the pancreas. And of course, if you don't make enough insulin, you can't control your blood sugar, and then you come up with these diabetic symptoms. And there had also been some previous reports of children developing type 1 diabetes in China and Italy, so that's another reason why they thought there might be a link. So they now want to have much larger studies, and they are asking other doctors in hospitals elsewhere to keep an eye out if they see a child who is diagnosed with type 1 diabetes, to see whether they have been in contact with the coronavirus.
What are parents supposed to look out for?
Well, Adnan, parents have always been told various symptoms of type 1 diabetes. I think it's one of the things that I remember being told when my kids were little, certainly. But they're now being told that if a child comes in contact with the coronavirus or another member of the family has got it, to be careful. And there's 4 easy things you can look for. They're called the 4 T's, and is the child thirsty? Thirstier than usual? Are they going to the toilet more often? Are they tired? And are they thinner? Are they losing weight? And a combination of these symptoms is enough to ensure that really you should go and check with your primary care physician and ensure that your child hasn't developed type 1 diabetes, which is treatable. It just means that you have to have insulin injections.
Nicola, thank you. Nicola Hill, our health correspondent in London.